Well, we'll start. So could
Yeah.
you introduce yourself?
I'm Caroline Masquillier. I'm a postdoc researcher at the University of Antwerp, and I'm the scientific expert shaping, together with a team of Mutualiteiten, which are health funds in Belgium, the first federal community health worker program in Belgium. In addition, I'm also the research and valorization manager of a research project in which we aim to learn from a community health worker model in Brazil and South Africa and translate this to the Belgian context.
Very well. And could you tell me how community health is organized in your country?
So in Belgium, there are a lot of small-scale initiatives in certain cities, but this federal community health worker program is really the first of its kind in Belgium, so it's very exciting. We have 50 community health workers who are working in socioeconomic vulnerable areas of 10 Belgian cities. They have received a basic training and they also receive remuneration for their work. The program started during the COVID-19 pandemic and it got prolonged now for another 3 years. So we're very excited that we keep be able to work on with community health workers in the next few years.
Very well. So COVID has changed many things in the country. Had an impact.
Yeah, absolutely. Yeah. At least that's one good thing that came out of the COVID pandemic, some innovation introducing community health workers. Yeah.
Very well. And how about, could you say something about what you've learned in the past few years on community health? I mean, when we think about stakeholder engagement, community mobilization.
Yeah, I think a big challenge in the federal community health worker program is the fact that the role of the community health worker is not always fully understood or clear for all the stakeholders involved. So for instance, for healthcare professionals, such as general practitioners, it's not always clear what a community health worker exactly does. And actually the same holds true for welfare organizations. And they sometimes then experience a sense of competition. But once they understand what community health workers actually do, this sense of competition is often no longer the case. And also for people who receive the support, so people who live in socioeconomic vulnerable circumstances, the role is not always clear, and sometimes they have expectations that the community health worker cannot fulfill. So this role clarification and explanation to the various stakeholders is something that is very key and something that we really have to work on towards the future.
Yeah, well, I mean, I know that you work in other countries. I mean, this is a question you were not maybe expecting. But I mean, we have a few things to learn from other countries, don't we?
We have a lot to learn from, especially low and middle income countries where community health workers are already present for such a long time. I have a lot of experience with community health workers in South Africa, but you have them everywhere around the world. And the lessons we learn from these countries, we definitely take with us in Belgium. So it's nice that we can learn from them and try to implement and build on these lessons. And one of the things that we definitely learned is the importance of training, the importance of good supervision, the importance of providing a remuneration for the community health workers, and also paying attention to their mental well-being. That's also something that is really key. So there's a lot to learn from low and middle income countries, that's for sure.
Okay. Yeah, well, and how about how does community health actually improve population health and well-being? Can you give us a bit of an idea of what difference it makes?
Yeah, so in Belgium, for instance, community health workers can really play an important role in improving access to healthcare for people who had difficulties in the past. So people often with low literacy levels, of people who live in poverty, newly arrived migrants. Community health workers reach them by working in an outreaching and proactive way. So they reach them on the street, in a food bank, etc. And the cornerstone of their work is first building trust. Often people lost trust in the health system, in our government, and they first built that trust, and from there they try to then overcome other barriers to access to care, for instance, administration, language barrier, etc. And they really can take the time to listen to people's needs and adapt their way of working according to the needs of a person. So sometimes they help someone with a clear question and then it's a once-off support, but sometimes they really help someone throughout the access to care continuum, and it takes several moments to meet each other and to overcome various barriers that people experience.
Very well. It's very interesting what you're saying. And so you've been working on in this field for a while. Any advice for this new generation of community health workers that is being trained, that is being actually involved?
Yeah, I think what is very important is paying attention to community health workers' mental well-being, because it can be a really demanding job with sometimes challenging situations, and taking care of one's own mental well-being is so important to be able to continue supporting those who are most in need. But of course, the community health workers shouldn't do this alone. It's important to have like a supportive structure around them with coaches, with training, with intervision moments, so that they can feel supported in the work that they do on a daily basis.
Very well. Thank you so much. It's been very interesting
My pleasure.
to have your testimony. So thank you so much.